Joining me now, John McLaughlin, pollster to the stars, or at least to the Republicans. He's here on behalf of Americans for a Balanced Budget. You've heard me talk about them on the show. John, thanks for being with us. You've got some new data you want to talk about. I mean, obviously, in the news and all over for the last few months, we've been talking about this issue of the Obamacare plan premiums that are expiring at the end of the year. This was at the center of the debate over the government shutdown. You've got some data on how this debate could affect the 2026 midterms. What do you got?
Right. We just did a poll that came out of the field. We did it November 10th and 11th. So it was done after Election Day this year, with those off-year elections. And it was 800 likely voters who tell us they're going to vote for Congress next year in 16 congressional districts, 8 toss-up districts, 8 lean Republicans, but they're all Republican districts. And we've got a very slim majority, so there's no reason to there's no margin of error here. We have to win. And the thing that's popular is they support healthcare tax credits. The healthcare tax credits that are taken by working Americans where their employers don't have health insurance for them, they have to go buy their own, and then a lot of times they have to go buy these, buy in these exchanges, and they get the healthcare tax credits for it. And the vast majority of voters are extremely concerned about this because 70 to 20 they support the tax credits, and that's among all these voters. And what you've got is 48% strongly support them, and they support the healthcare tax credits. They're higher among Democrats, 93, but Republicans still 53. Independents support it, 66% support it, 73% among independent women. And Hispanics, 79. So it's among the key voter groups. These healthcare tax credits are extremely important for working people to be able to afford healthcare, and all voters seem to recognize that. And when you're looking at it, the idea for if somebody votes to continue the healthcare tax credits, 57% are more likely to vote for that candidate for Congress. 53% are less likely to vote for a candidate who allows the tax credits, the healthcare tax credit, to expire. And the bad part is, in these districts right now, the Republicans have a chance of winning. It's like the party affiliation is 40% Republican in these districts, only 36 Democrat. And if they expire, they'll vote generically for a Democrat based on this issue, 51-41. So, Congress needs to come up with a solution for this. We can't just let, working class people who supported Donald Trump for president to go cold turkey in effect and not be able to afford to be able to buy their own health care, because they don't want to go on Medicaid. They don't want to go on government support. They want to use the tax credits to buy their own health care. And like the president said, he'd like to give it to the voters, let them buy their own health insurance.
Would that be an acceptable solution for people if they do what Trump says here? Is let's just go direct. And I had Senator Cassidy on from Louisiana earlier this week.
Mm-hmm.
He's working on a plan like that. Is based on your data, is that something they would accept?
The voters would accept that, but the problem is with the Democrats. I think a lot of these Democrats want the subsidies to expire and the exchanges to collapse because they want government-run health care.
Yeah.
They want to decide when you could go see your doctor, and which would be a disaster. You'd end up like Canada, where people they can't get health care and they end up waiting in line to die. It's just a bad situation. So I think. Senator Cassidy was talking about health savings accounts. Like years ago, I worked for Steve Forbes, and he proposed those ideas, which are a great solution. But right now, it's like if whether it's means testing, whether they do it by income, for working class people or something, we've got an immediate crisis because affordability is the top issue. 9 in 10 voters are concerned about the cost of their health care. And when you ask them about, what are they concerned about with affordability, they're telling you 39% is healthcare, 38% is their food and groceries. So,
wow, so
it's right up there.
Actually ranked in above food costs for people in terms of the affordability or cost of living issue.
Right.
Wow.
Exactly.
All right.
And it's higher with women. So
one of the foremost pollsters in America, giving us the data here for Americans for a Balanced Budget. If you would like to lend your voice to this debate and learn more about it, you can go to stophealthcosthikes.com, stophealthcosthikes.com. That's their website. and you can get involved in this conversation where you're going to urge Congress to do something about the looming cost increase in health insurance before it hits their wallets. John McLaughlin, thanks for joining us. We are going to take a break, and when we come back, Carol Markowitz from Fox News and the New York Post will join us. Don't miss it. Scott Jennings on Salem Radio.